today I'll be demonstrating a video on hypoglycemia. So I arrive at the scene, patient seems to be unconscious and non-responding. I do a size up of the scene seems to be safe. At this time we're unaware of what the cause was or how my patient suffered this injury. So I'll start by determining how many patients I have. I clearly have just one male at the time. He's probably within the age of 20 to his 30s. I'm gonna go about assessing my ABCs on him, so I'm gonna check for airway. Patient seems to be breathing fine and airway's open. I'm gonna go about checking his circulation next. But have him straighten out. Patient seems to be fine. He has blood circulating at a normal rate. I'm going to go about doing a head-to-toe size up on him as well, just to make sure he has no injuries or suffered any injuries before we arrive. Straighten out the patient, just making sure he has no injuries. He has a pulse. So as we did the head-to-toe size up, our patient seems to not be injured in any type of way or manner. He's not bleeding. We're gonna go by checking his vitals. Strap this on real quick. Wait for the monitor to read what he has. Patient seems to be having 108 beats per minute, which is pretty strong, but his skin seems to be cool, pale, and calming. From a friend or from a person at the scene, patient seems to have some diabetes or history of diabetes. According to her, he had dinner about 7 hours ago, but states that he's been unconscious for the past 7 minutes. So what we do is probably administer some insulin for him and go about other treatments as we take him to the nearest hospital. So reassessment of vitals will happen as we are transporting the patient, and insulin will be given if needed to. So as of now, our patient will be transported to the closest nearby hospital, probably St. Agnes. And that concludes my demonstration of hypoglycemia.